viewers! Ako si Rizal Marqueses, ang host na nag-iisang St. Cabrini Health Access. Kayo ba ay nakakaranas ng pamumula, pangangapal, makati at nagkakaliskis na balat? Ilan lang ito sa mga sintomas ng sakit na ating tatalakayin ngayong araw na ito. But before that, let us all first watch this video. Ayan, at dahil ginugunita natin ang World Psoriasis Day, we invited ang nag-iisang dermatologist dito sa St. Francis Cabrini Medical Center. Ang napakaganda ngayon, Dr. Gina Eubanas. Dr. good morning. Magandang araw po. Welcome po sa St. Cabrini Health Access.
Magandang umaga rin. Ano pa ngayon? Magandang araw din sa inyong lahat. At salamat sa iyong pag-imbita sa amin dito. Tama ka, today, this month is World Psoriasis Month, no? Yun.
Ayan. Sa lahat ng mga viewers na nanonood sa atin ngayon, make sure to join our discussion by typing your questions on the comment section below. And for those who are viewing through our Galaxy cable, you can still send your question through our Facebook page. It's St. Cabrini-corporate page. Ayan, Doc. Let's start our discussion by defining what is psoriasis.
Psoriasis is a skin condition. It's usually chronic, meaning tumatagal or pangmatagalan, that involves the epidermal layer of the skin. Ang characteristic nito ay kumakapal at nagkakaroon ng matigas at maputing kaliskis sa ibabaw, or what we usually call micaceous scale, kasi para siyang yung bark yung part ng tree na maputing-maputi, no? Yun. And it usually proliferates either sa buong katawan or certain parts of the body lang. There are different types of psoriasis. We have the guttate or the very small ones, parang tuldok-tuldok lang na mga spots ng psoriatic plaques. And then we have the big plaques na parang isla, mapa-mapa. We have erythrodermic, which is yung pamumula ng buong katawan. We have pustular psoriasis na ang characteristic naman ay parang mga maliliit na nana. Yun.
Ayan, so parang nag-jump na rin tayo sa next question na what are the signs and symptoms? What are the common causes of psoriasis, Doc?
Well, technically hindi siya common cause, but ang pinanggagalingan nito sa ngayon ayon sa mga pagsusuri ay yung tinatawag na autoimmune disorder. Meaning, yung sarili mong katawan ay lumalaban sa iyong sarili, no? Meron tayong certain genes sa katawan na pag yun ay na-manifest or switch on, ay lalabas ang psoriasis. Given there some initiating or precipitating factors, meaning may nagpapatulak sa kanya na lumabas, then eventually lumalabas siya, no? This was already isolated and targeted at chromosome number 6. Yun ay part ng chromosome natin. So if we have that short arm of the chromosome 6 na meron nung gene na yon, then eventually it will manifest.
Ayan, Doc. Meron kasing mga tao na nami-misconception nila yung psoriasis na once na nakikita nila yung tao, is it contagious, Doc? Once
Hindi.
na yung tao ay may...
No, it's not contagious. It may appear na parang ang dami-dami kasing parang sugat sa katawan, but it's not contagious. Actually, if you have a parent who is psoriatic, no, you have like 16% chance of having the same condition. Ngayon, if both of your parents have psoriasis, 47% na ang chances na magkakaroon ka. Halos 1:1, ano? Pwedeng meron, pwedeng wala. And it happens in each and every child born. So, depende yon sa pagkakapanganak sa'yo. Kung nakuha mo yung gene, then chances are it might come out, no? Yun.
And if ever, Doc, for example, sa kanya, hindi siya nag-occur, pwede yun sa next
Sa
generation.
susunod na
Ano,
generation,
Doc?
pwede rin siya mag-skip. Oo, kasi maipapasa mo pa rin yung gene na yun, no?
Yes.
Oo, tama
Opo.
ka.
What are the available diagnostic tests dito po sa St. Francis Cabrini Medical Center na pwede nating i-offer?
Gamitin.
Yes po.
Sa ngayon, ang alam ko, kung nakikita sila ng derma, ng accredited derma, or at least yung mga marunong tumingin, by sight kita namin, no? At least may suspecha na kami na siya yon. But the definitive diagnosis is always biopsy.
Okay.
Oo. Hindi naman siya something. Merong mga signs like the Auspitz sign that we look for when we look at a patient with psoriasis. So, Auspitz sign is like pag tinungkab namin, may konting dugo-dugo na makikita, no? But that's characteristic of the condition itself. There are other manifestations that we also look for in psoriasis because, for instance, when you have psoriasis, you can also develop psoriatic arthritis, no?
Yes.
So, para siyang rayuma, pero hindi. Rayuma siya na dahil sa psoriasis or part ng psoriasis.
Ayun. Parang Doc, parang ang ibig niyo po sabihin, meron siyang arthritis, then meron siyang skin
Condition. Oo.
So,
Ang
dalawa
pinagkaiba nun, yung sa rayuma natin, karaniwan nandito sa mga malalaking buto o kaya sa knuckles. Ang psoriatic arthritis nasa dulo. Ng mga,
okay.
yung dalawang dulong joints ng ating mga daliri, ganun din sa paa, sa mga kuko, no? Sa minsan din nadadamay din ang tuhod natin. Kaya yung mga may psoriasis, pag medyo matagal na silang meron at nag-develop nga nun, minsan hirap din maglakad.
So, na-define na natin yung ating diagnostic test.
Yes.
So, is there any cure for the psoriasis?
Psoriasis.
Yes, so Doc.
We don't really call it cure kasi isa sa mga characteristics kasi ng psoriasis, natitrigger siya. So, it can be triggered environmentally or seasonally. It can be triggered by your condition, your physical condition. Pwedeng stressed ka kasi meron kang ubo, sipon, may flu, it comes out. You have other conditions in your body that affects it as well, lalabas din yon. It's what we do is we try to control the condition. When we say control, dun sa pansamantalang alam paglabas niya o dun sa flare up ng psoriasis, we give you medicines for it, no? I should also mention that psoriasis is also implicated as part of the metabolic syndrome. Ang metabolic syndrome, kung sa mga iba kung napag-diskusyonan na ito, ay composed of yung obesity, increased BMI or pati yung waistline, diabetes, hypertension, at saka hyperlipidemia. Hyperlipidemia, yung mataas ang mga cholesterol, no? Yun. So, having said that, kung meron dito sa mga ito na kondisyon na hindi kontrolado din ng inyong katawan, like hindi kayo matataas ang inyong sugar o mataas ang inyong cholesterol levels or meron kayong nag-increase kayo ng weight, then possible na lumabas yung psoriasis or makidagdag sa gulo yung psoriasis, kumbaga, no? So, what we do is we try our best to control all the other tawag natin comorbidities o mga kasamang mga ibang kondisyon. We try to treat whatever we can. Kung may ubo, may sipon, may lagnat, may sakit, gamutin natin para kumalma rin yung psoriasis, no? For as long as, and then in itself, psoriasis as a condition can be treated with topical agents, yung mga pamahid. Meron ding mga gamot na iniinom kung sakaling kailangan naming medyo maging mas agresibo. And eventually, we also have yung tinatawag na phototherapy, PUVA, yung iilawan ka. I'm sure yung iba sa inyo dyan na may psoriasis na naranasan nyo na to, na pinapasok sa cabinet, tapos iniilawan kayo so many times a week. And then there's the injectable, so yung mga gamot na biologicals which we use to rapidly control the condition.
So, mas nire-recommend nyo po yung phototherapy?
Only if affordable and kaya ng pasyente na pumunta ng ganong clinic na depende yun sa kaso. So, as with regards to dun sa mga therapeutic plans or strategies, we have plenty. We have the topicals, mga pamahid, no? Mga hinahaplos, mga lotions, and we have the oral. Sa oral, we also go aggressive with that. We do some laboratories to help control the condition if hindi kaya, no? And the third is phototherapy, wherein naiilawan yung katawan. They go inside this cabinet, no? Some of our patients are familiar with that. And then they do the sessions, so every so often in a week, and then to control the plaques. And then the last one is yung biologicals or some of the injectables, no? And these are also very fast moving, very fast acting ito. Mabilis din ng recovery, although medyo pricey. I always advise my patient, kung sa gamutan lang hindi tayo mawawalan kasi ang dami hong available.
Yes.
Pero it all depends on how much you can afford to, no? And at the same time, I guess the most important advice I would give my patients usually would be to know or understand their condition. Kasi half of the problem or technically half of the problem will be solved if kilala mo yung balat mo.
Okay.
Alam mo kung ano yung nagpapalabas sa kanya, alam mo yung nagpapagalit dun sa psoriatic attacks mo, alam mo din kung ano yung papalala sa kanya, no?
Okay.
Yan. For some patients, alam ko na sinabihan ko na sila na huwag nang iinom kasi minsan pag uminom na nigarilyo, lumalabas talaga yung plaques nila. Yung iba naman, sinasabi ko, huwag ka na magpapabigat, mag-dieta ka na. Pag nag-dieta ka, baka mas mabilis. In fact, it's already proven and it's in the studies na weight loss is talagang important, no? Kasi part siya nung treatment plan din, no? Yung dieting. Yun.
May mga cases ba, Doc, na once na yung psoriatic patient is na-diagnose, then na-control niya yung weight niya, then nawala si psoriasis?
Yeah, I've seen some patients na sandali lang lalabas, no? Mga few years, tapos mawawala.
Yes.
Kasi hindi na bumabalik. Meron naman ako, mga mawawala, tapos pag na-trigger na naman sila ng a different form of stress, then lumalabas.
Lumalabas
no?
ulit.
Oo. So, pag basta relax sila, maganda ang kanilang disposition, at saka nasusunod nila yung lifestyle na yon, then it goes away. It literally clears up. And then, pag na-stress na naman sila, eto na naman lumalabas. So, it's one of the conditions na talagang, wow, kitang-kita mo talaga how stress affects the body, no? Naman. There.
Okay. Dun sa phototherapy, Doc, is it yung specific na may psoriasis?
Na part?
Yes, na part lang or whole body na siya?
Merong mga gano'n na kapag yung lugar lang na meron, siya lang yung naka-expose and then we cover the rest of the body, no?
Yes.
In fact, mas matagal yung preparasyon kesa doon sa actual exposure kasi minutes lang talaga yung exposure eh. But then, for some patients na alam namin na it will be encompassing and which is usually the case pag PUVA or narrowband UVB ang ginagamit namin, usually we indicate it for patients na talagang puno na yung katawan.
Okay.
Kaya karaniwan, ulo na lang yata or mukha na lang yung natatakpan namin, no?
Ayan. So, thank you, Dr. for answering the first set of questions that we lay down. And after our break, sasagutin po ni Dr. Gina yung mga questions from our live viewer. So, magbabalik po ang St. Cabrini Health Access. Welcome back at St. Cabrini Health Access, and we're still here with Dr. Gina Eubanas, and we're talking about psoriasis. And para doon sa mga viewers natin na kaka-join pa lang, it's never too late to send your questions, and later on, Dr. Gina will answer it live na live. So, Doc, proceed na po tayo sa pagsasagot. So, yung first question po natin ay galing kay Marinel. Ang sabi po niya, what is the difference between psoriasis and eczema?
Okay. They're two different entities, pero pareho silang kung tawagin ay chronic, no? Although, ang similarity nila, I guess, would be yung microbiological factor, which is yung ating white blood cell, no? Meron tayong tinatawag na T helper cell at saka T helper cell. Meron types 1 and 2 yon. Yung type 1, yun yung lumalabas ang defective sa atopic dermatitis or eczema. T helper 2 naman yung para sa psoriasis. So, in essence, pareho sila ng pinanggagalingang or ang ina-attacking cell, pero magkaiba sila ng manifestation, no? Ang eczema pareho dry, makate, tapos makaliskis, pero hindi agasing kapal ng psoriasis. Pareho silang pwedeng ma-induce ng stress. Pero yung isa, yung atopic dermatitis or yung mga eczemas, meron talaga silang specific agents, no? Like, alam ko ng atopic dermatitis, seasonal yan. Either pag mainit o malamig, kakatit ka. Tapos may mga characteristic areas like yung flexural areas, leeg, yung anticubitals, yung sa likod ng paa, yung alak-alakan, saan pa, sa bewang minsan, no? Very dry ang skin ng atopic dermatitis, at ito ay parang inherent sa kanila, no? Sa mga may skin asthma. At saka ang mga may skin asthma, laging nangangati. Parati silang tinitingnan mo parang nagkakamot lagi. Ang trigger nila, yung kamot. Pag kinamot nila, lumalabas yung gaspang ng balat.
Okay.
So, they're two different entities. You can experience one but not the other. Hindi sila usually sabay.
Sabay, okay.
Oo, hindi sila usually sabay.
Yung physical condition nila, 'di ba yung psoriasis is dry tapos makapal yung balat?
Mas makapal ang balat ng psoriasis. At ang psoriasis usually buo, makikita mo siya, no? Talagang namumuong ganyan. Ang eczema minsan kumamot ka, ikaw mismo nagpapakalat sa kanya at nagpapalapad, no? Okay. At pareho silang hindi nakakahawa, pareho silang nga naman namamana.
Okay. Yung next question natin ay galing kay Joy. Ang sabi po niya, are there any other condition linked to psoriasis?
Yung, meron nga. Yung nakwento ko sa'yo kanina,
yes,
no?
Doc.
Psoriatic arthritis, and then the metabolic syndrome, no? Yung merong mga matataba dyan, or yung mga mabibigat, mataas ang BMI, o obese, yung malalaki ang bewang, may diabetes, hypercholesterolemia or mataas na cholesterol levels, at saka yung may high blood. Yan, posible yun.
Doc, for example, yung patient is may psoriasis, pwede siyang magkaroon ng psoriatic arthritis. Kumbaga, hindi agad-agad arthritis agad.
Hindi. Pwede rin naman na nagmamanifest yung arthritis for some, pero hindi sila aware na meron pala silang iba pa. Kasi meron din tinatawag na nail psoriasis, scalp psoriasis, no? Na hindi kailangan mag-manifest sa balat ng katawan. Maaring sa kuko lang at sa ulo lang. Tapos maya-maya malalaman mo meron silang psoriatic arthritis. But most of the time, nagde-develop yon pag meron ka ng psoriasis.
Doc, nabanggit nyo kanina yung scalp psoriasis. Can you identify, Doc, the difference between dandruff and psoriasis? Yes po.
Meron kaming
kasi
condition.
Kasi na-interpret nila minsan
as like that. Ang balakubak, maninipis, di ba? Yung sinasabi natin na para kami snowflakes sa katawan.
Yes.
Ang psoriasis, malalaki, para ka merong mga kaliskis ng isda.
Talagang makapal,
buo. Buo-buo yung nalalaglag sa'yo. At makikita mo, pag hinawi mo, puting-puti yung anit. Para kang, para kang nababalutan ng helmet na maputi, no? For some naman, merong in-between, kung tinatawag namin na psoriasis. Some doctors still believe na meron pang condition na psoriasis na nasa cross between seborrheic dermatitis o yung balakubak na sinasabi mo at psoriasis. Yung panggitna siya sa dalawa.
Yes.
Meron din ganung condition. But again, the best way to confirm is to do biopsy. Yun.
And then, syempre, kung may nakikita na kayong symptoms na nasabi natin kanina, magpa-check agad kayo sa ating dermatologist like Dr. Gina Eubanas.
I would suggest, I highly recommend that if you have something that's existing already or you're experiencing some of this na familiar or mukhang parang ito yung sakit ko, do not self-medicate. Try not to self-medicate. And tingnan, pakita nyo na lang. Marami kayong mga certified and accredited dermatologists from the Philippine Dermatological Association or Society na pwede nyong tingnan. May website kami. Pwede nyong tingnan ang listahan ng doktor doon sa website namin at kung saan sila nakaklinik. Nandun yon, makikita ninyo nang magabayan kayo kung kanino yung napapatingnan at sino makakakita sa inyo nang alam ninyo na yung tumitingin sa inyo ay yung mga kwalipikado at nakapag-aral tungkol dun sa sakit na yon.
Ayan. So, yung next question natin, Doc, ay galing kay Carla. Ang sabi niya, is it true that psoriasis is due to bad hygiene?
Well, hindi, pero nakakatulong yon kasi kung marumi ka or hindi ka maayos sa sarili mo, maaari kang mag-develop ng iba pang kondisyon na magli-lead to psoriasis. Or say for example, hindi ka palaligo. Alam mo namang pag hindi ka naligo sa panahon ng ganito, maaligas-ngas yung pakiramdam sa hapon, mapapakamot ka. Kaya kung meron ka psoriasis, lalo kakamot, lalong dadami yung lesions mo o yung sugat mo. So, you might as well keep yourself clean and hygienic at all times. Yun.
Doc, what do you recommend yung about dun sa water? Is it cold or...
Well, hindi ako hard and fast sa hot and cold water. I'd suggest na kapag malamig ang panahon, wag namang sobrang init yung panliligo mo kasi baka ma-trigger lang lalo yung panunuyo ng balat mo at lalong bumalik yung sugat. Ganun din pag malamig or mainit, wag naman sobrang lamig na to the point na ganun din, matutuyuan ka rin ng balat. So, yung extremes, I guess, hindi ako masyadong boto doon. Siguro warm, lukewarm, or even the regular, tap water would do, I guess.
Ayan. Ang next question po natin galing kay Jeff. Ang sabi po niya, how can we prevent ourselves to have psoriasis?
Prevent?
Yes.
Like I said, hindi siya something na it's dictated by your genes. So, medyo mahirap i-prevent. But, kung ikaw ay may parents na may psoriasis, alam mo may chance na magkakaroon ka. Kung alam mo kung ano yung mga posibleng makapagpalabas sa kanya, tulad nung sinabi ko kanina, yung alcohol, obesity, yung pag-rima, tsaka yung diet na healthy diet. Kung alam mo kung ano yung pwede mong gawin para maiwasan siya, then keep yourself healthy at all times. Exercise, healthy living, healthy lifestyle would help minimize, at least kumbaga sa pintuan, masaran mo siya ng door para mapigilan mo na hindi agad pumasok at lumabas sa katawan mo, Yun.
Ayan. Yung next question natin, Doc, galing kay Jessie. Ang sabi po niya, applying apple cider vinegar in scalp is good?
Okay. Yung mga herbals, sinaliksik ko din yan, wala kasing proven na talagang nagsasabi or study na magpo-prove na pwede yung apple cider. In fact, marami pang ibang halaman na sinubukan sila. I think sa lahat ng yon na ginawa na study or meta-analysis on other topical agents or even what we call organic or herbals or home remedies,
Yes.
Wala kasi sa kanila na talagang may hard evidence to prove that they really work. However, except one, yung sa obesity, yung diet. Ayun. Yun talaga na prove nila na pag nag-lose ka ng weight, significantly bumababa din yung at bumibilis din yung pag-treat or pag-heal ng psoriatic plaques or at least even the relapses or yung pag-ulit, no? Yun. What I can say is, and this I always tell my patients, I'm okay if you want to try something na sinubukan ng iba kasi napansin nila na nakatulong yon. I'm fine with that for as long as you inform your doctor about it, so that we can advise you if it will affect the current medications you're using. Kasi kung yun lang ang pagbabasihan natin, yung mga nakikita natin sa internet na sinubukan ni ganito, umokay sa kanya, tapos titigil mo yung gamot na talagang nag-work sa'yo, it would be difficult for us to decide whether yung gamot mo ang nag-work or alam mo yon, baka lumala lalo, mas mahirapan kaming gamutin pa in the end, no? Yon. So hindi ako averse dun sa paggamit ninyo for as long as you tell us and you don't stop the medicines that are already working. No? If you're already using it and it works fine, don't stop it.
Many people kasi na, uy, gamitin mo to, maganda to, tapos effective to sa akin,
so true.
ganyan.
Oo. Marami ako niyan, mga langis-langis.
Yes,
Oo. In principle, okay nga sa akin ang langis kasi it moisturizes, no, lalo na sa scalp. I'm fine with that, no. So it really doesn't matter. Kaya lang, once you start feeling something else or seeing or observing something else, no, imbis na gumanda yung condition mo, lalong lumala, lalong kumati yung anit mo, lalong dumami yung magaspang sa katawan mo. Pero medyo mag-isip ka na baka hindi siya talaga nag-work, no?
Yes.
Maybe it would have worked or it worked for your other friend, pero sa'yo baka hindi naman pwede, no? So that's why we say na hindi lahat ng tao masasabi mong applicable yon, no?
Ayan, thank you, Doc. So, ang next question po natin ay galing kay Anton. Ang sabi po niya, what food should I eat and avoid to relieve the symptoms?
Ulitin ko, sinabi ko na yung kanina na talagang healthy diet would really work, no? I have this patient na used to drink alcohol and then would eat red meat, no? Mahilig sa pulutan no? Oo, nung nagkaroon siya ng malawakang psoriasis, na dinicide niya, titigil niya. So, he would start eating vegetables, fruits, fish, yan, fresh na, and then white meat na lang daw kinakain niya. And then, it started clearing up. Aside from, of course, yung medicine, It's just that for once, biglang nagulat siya na tahimik daw yung kanyang katawan. So, he was using the medicines, tumahimik na yung katawan niya. And it took a while before they started appearing again. So, sabi niya, it worked. So, for him, it worked. And it really does, no? Lalo na kung affected ang katawan mo in terms of yung tumataba ka, bumibigat ka, lumalaki yung waistline mo, then it really does affect it also.
Doc, kasi meron akong friend na may psoriasis din siya. And then ang sabi niya kasi is bawal siya ng isda, bawal siya ng itlog kasi malansa siguro, Doc.
We don't really, wala siya sa listahan. I mean, walang hard and fast evidence or hard evidence that should say na malalansa affects. In fact, food in itself will not affect psoriatic episodes. Mas kumain ka na miski yun lang yung food that will make you bigger or gain weight, then yes, in excess. But particular food, food in particular, any particular food in that sense, hindi. Yung bawal kasi ito yung magkukos, hindi naman. Although, but there is a study though, vitamins, we've noticed that in psoriatic patients, bumababa ang vitamin D levels or even zinc levels, no? So, you might want to increase your supplements on that.
Okay.
Supplementation lang naman yon.
Okay, yung next question natin ay galing kay Leo. Ang sabi niya, can I try products to get rid of psoriasis?
Yun. Like, kung susubok tayo ng mga nakikita nga natin sa internet, like I said, if you're already under medication with for your condition, yes, you may just tell the doctor na you wanna try this and you want to include it in your regimen para masama niya sa kung papaano. And then, ma-observe din ng doctor mo
Yes,
ano yung
opo.
naging epekto nung dinagdag mo dun sa current medications. No? It's not to replace what you already have because we already know na it works for you, but just to supplement it maybe. Yes.
The key is be honest to your doctor.
Yes, and to yourself. Kasi
Yes.
mahirap din naman na subok ka ng subok, gastos ka rin ng gastos.
Opo.
And then you end up lalong lalala yung condition mo, and eventually, mas tataas na naman yung gastos mo afterwards
Yes,
kasi
opo.
itatry mo na naman siyang tanggalin, no? So, you might want to minimize kasi alam mo na paghahandaan mo siya. Like, again, it's more important na you know your condition. You understand what makes it come out. I have this patient na she would come to me, dadali siya ng husband niya because she would have severe attacks of psoriasis. And we couldn't figure out what would make it come out. Sabi nung doktora, wala na nga siyang ginagawa sa bahay. Hindi na siya nagwawalis. Hindi ko na siya pinapatrabaho. Sabi niya, kasi sasabihin niya, alikabok, ganyan-ganyan. Tapos hindi rin talaga. So we tried. We would treat her and then I would give her medicine because the husband would come over silang dalawa and then I would treat her and then wala na. They're gone. No? So wala, okay na daw. Sige. And then eventually I realized, both realized the husband is a military man. He goes on missions and he would be away for several months, maybe 2-3 months, not coming home. During those times na wala siya, nagfi-flare yung psoriasis. So by the time he comes home, we would treat the wife. And then the wife would get well because he's around. Then he goes away again for a mission. Wala na naman siya. A month later, may attack na naman siya. So, finally, we realized when the husband came back, sabi ko, hindi ho kaya ang source of stress ng inyong asawa ay kayo kasi nawawala kayo and she's stressed out kung ano nangyayari sa buhay niyo kaya siya ganyan. So, we tried it for like, humingi siya ng leave for 6 months and tahimik kami for 6 months.
Okay, that's
So, we realized that the stress is personal, no? Very personal.
and very simple, Doc.
And very simple. Yung worry niya sa asawa niya, yung hindi nakakatawag, hindi nalalaman kung anasaan, yung hindi nababalik. Talagang stressed out si wife. In such that, magfi-flare yung psoriasis. But when he's back for a vacation, wala si psoriasis, di ba? So, sabi ko, mami, next time sumama ka sa mission. Niloloko namin siya noon. So, yun. Well, fortunately na, I know, siguro, I don't see her anymore. Maybe nag-desk job na si Sir, no?
Yes.
Baka mataas na yung position, desk job na siya, so kita na siya araw-araw ni Mrs.
Opo.
There you go.
Ayan. Ang sabi naman po ni Oscar, is it true that during pregnancy, psoriasis get worse?
Hindi. Studies would show na 50-50 siya. So, wala. Hit or miss tayo dyan pag buntis. Either you get pregnant and it worsens or it clears up. So, wala siyang 50-50 nga daw sa study. And it doesn't also mean na pag babae o lalaki yung pinagbubuntis mo, lalabas yung psoriasis, no? Kasi yung iba sasabihin, lalaki yan kasi may psoriasis ka. Hindi, wala lang. It's random, 50-50 that chances are 50-50 that you will get it or you won't get it.
Okay. Thank you so much, Doc. And lastly, can you give our viewers a general advice about our topic, yung psoriasis?
Psoriasis.
Yes, Doc.
Okay, ulitin ko. Sana kung meron kayong nararamdaman o nakikita sa inyong mga balat na kayo ay nagdududa, no? I'm sure some of you may have tried to self-medicate for a while kasi tingin niyo gagaling naman, but you try and see us. It would be it's more cost-effective to see us kasi we will give you the right medicine once, and you also get the right advice as well, no? Yun. So, go and see if you have something in your body that bothers you, mga sugat-sugat, mga galis, kaliskis, or kung ano man. Come and see us. We are members of the Philippine Dermatological Society. We have a website. We have a Facebook page. You look at it and go visit it and see the list of the doctors in your area and tingnan doon kayo pumunta sa kanila. I think the schedules are also there. Oo. I would also like to remind you guys, since it's World Psoriasis
Yes.
Month, on October 27, we have our annual psoriasis walk. We call it SOR Walk. And this year, it's going to be held at the San Andres Stadium in Manila. This will be on October 27. It's a Sunday, 6 a.m. po yun. So, ang mga nagwo-walk po yan, this is an annual walk. It's a fundraising activity for our psoriasis patients. This is in cooperation with SORFIL or Psoriasis Philippines. It's a group of it's a group that's comprised of psoriasis patients and their families. And that group seeks to raise funds so that they can help each other, with providing for their treatment and for other projects that would help other patients with psoriasis. You can also join them. They also have a website and a Facebook page, SORFIL.
Ayan, thank you, Dr. for having us
salamat
today. And for those viewers na interested sa clinic schedule ni Dr. Gina Eubanas, nandito siya every Wednesday, 10 to 12, and every Friday, 1 to 3. Ayan, thank you, Dr. And
salamat sa
thank you, Dr. for sitting down with us and explain to us. And dito sa episode na to, nalaman natin na ang psoriasis ay hindi nahahawa. So, to keep you guys updated to all happenings at St. Francis Cabrini Medical Center, please make sure to like our Facebook page. It's St. Cabrini-corporate page. Muli, ako po si Rizal Marqueses and this is St. Cabrini Health Access.